Hello, this presentation will be on drug therapy of gout. Gout is a recurrent inflammatory disorder, mainly seen in men. Um, lab testing for gout is primarily by looking at the uric acid levels. So uric acid levels greater than 7 milligrams per deciliter for men or 6 milligrams per deciliter in women would indicate gout. There would be uric acid crystals deposited in the joints if you did a aspiration. Episodes of severe joint pain, particularly in the large toe, are characteristic of a gout attack. Patients can not even barely stand to have the sheet touching their foot during that time. The causes are the excessive uric acid and then the impaired renal excretion of uric acid. Drug therapy for gout, short term to relieve the symptoms of the attack. When there's infrequent flare-ups, less than 3 a year, NSAIDs are your first line agents. Glucocorticoids can also be used to help with inflammation. For long-term therapy to keep the uric acid levels low, or if you have more than 3 episodes a year, you're going to use those drugs that are specific to treat gout. So with the NSAIDs, which are the first choice, you do that because they're better tolerated than the colchicine, and relief is within the 24 hours with swelling subsiding in the next few days, which is quicker than you would see, and giving the patient more relief. And of course, with NSAIDs, you got to watch for the GI ulceration, decreased renal function. So you want to make sure your patient has sufficient renal function before you would start an NSAID. You have to watch for fluid retention and increased risk of cardiovascular events. The NSAIDs that are commonly used include indomethacin, naproxen, and diclofenac, which is Voltaren. One of the things with Voltaren is you have to have that patient checked for their peripheral vision because it can affect their visual field. So when they're on that medication, that's something that has to be done on a yearly basis. If the patient is placed on glucocorticoids, the most common, of course, is going to be prednisone, which is highly effective in relieving pain. It's useful for patients who are hypersensitive to or unresponsive to other meds and have medical conditions such as GI issues that would preclude the use of NSAIDs or any kidney disease. You do also want to avoid in patients prone to hyperglycemia because it can raise blood sugar levels. So if you have a diabetic that's not well controlled, you would not want to consider this as a first line treatment for that patient. Colchicine is also used as an anti-inflammatory agent. It is no longer the first line. It is now reserved for patients who are unresponsive or do not tolerate safer drugs such as NSAIDs or prednisone. It is not effective against any other anti-inflammatory disorder. It is used when it has to be used to treat acute gout attacks. It can help reduce the incidence of attacks, and it can abort an impending attack. The precautions with colchicine and contraindications are you must be careful with the older adult, the debilitated patient, patients with cardiac, renal, hepatic, and GI disease, and it should not be used in a pregnant patient. Drug therapy for hyperuricemia. The goals of therapy are to promote dissolution of the uric crystals, to prevent new crystal formation, disease progression, reduce the frequency of an acute attack, and improve the quality of life. Because these agents have no analgesic or anti-inflammatory action, they are not useful in an acute attack, so these will be used, the following drugs will be used um, to prevent attacks. So those drugs include allopurinol, febuxostat, and probenecide. And they all they inhibit uric acid formation, and probenecide increases uric acid excretion. So allopurinol reduces the blood levels of uric acid. It's used for chronic gout, for hyperuricemia due to chemotherapy. Side effects, it's usually well tolerated, but there can be a hypersensitivity syndrome, GI effects, and some neurologic effects. It is the current drug of choice for chronic tophonous gout. It reduces blood uric levels, prevents new tophus formations, and causes regression of tophi that have already formed, allows joint function to improve, and it also decreases the risk of formation of deposits in the kidneys. Other uses, it can be used when there's hyperuricemia secondary to cancer chemotherapy, and for certain blood dyscrasias such as leukemia. Mechanism of action, it inhibits the xanthine oxidase, an enzyme required for uric acid formation. And we already went over some of the side effects. To stress again that a rare but potentially fatal hypersensitivity syndrome can occur. The Uloric reduces blood levels of uric acid also. It is also used for chronic gout. Side effects here are uncommon, but can include liver function abnormalities, nausea, arthralgias, and rash. Probenecide, in its only generic form of probenecide now, it acts on the renal tubules to inhibit reabsorption of uric acid, so it prevents formation of new tophi and helps diminish existing tophi and may exacerbate acute episodes of gout. So in that, you may want to add indomethacin for relief if necessary, the NSAID. Adverse effects is usually well tolerated, but there could be mild GI effects, so it would be best if it's taken with food. And there is a risk of kidney damage that can be minimized by making sure the patient is drinking 2.5 to 3 liters of fluid during the first few days of treatment. And you want to watch for drug interactions with aspirin and other salicylates. So the first question for this presentation, a patient with acute gouty arthritis requests for information on the preferred drug to take to treat a painful flare. Which drug would you recommend? And the answer here would be D. Naproxen, the NSAID, is first line. The other meds listed here are for chronic and not acute treatment. Second question, a patient is prescribed allopurinol for chronic gout. The patient develops a rash. What is the priority intervention by the nurse? And the answer is A. You want to stop that medication and assess the patient for liver and kidney failure. In this case, what you're worried about is the hypersensitivity syndrome, which